Have you ever spotted a tiny red mark on your skin, with blood vessels spreading out like spider legs? These aren't just random blemishes, they're called spider angiomas, and they could be your skin's way of signaling something deeper. In this video, we'll uncover what causes these skin spiders, when they might hint at a health issue, and how to safely treat or remove them. Stick around, this could change how you see those red marks forever. What is a spider nevus? A spider nevus, also referred to as a spider angioma, nevus araneus, or vascular spider, is a benign vascular lesion composed of a central dilated arteriole surrounded by smaller radiating capillaries. The appearance resembles a spider, with a central red spot and outward legs, hence the name. These lesions are typically located close to the surface of the skin, and are most commonly observed on the face, neck, upper chest and arms. Spider nevi may occur in individuals of any age, but certain factors increase the likelihood of their development. Hormonal changes, such as those seen during pregnancy or with oral contraceptive use. Liver disease, particularly cirrhosis, where spider nevi can appear in greater numbers and are considered a clinical sign of chronic liver dysfunction. Excessive sun exposure, skin trauma or injury. Idiopathic cases, where no identifiable cause is present. While spider nevi are generally benign and asymptomatic, their appearance in large numbers or in specific clinical contexts may warrant further evaluation, particularly to rule out underlying liver pathology. In most cases, spider nevi are asymptomatic and present solely as a cosmetic concern. Rarely, individuals may experience mild irritation or discomfort around the lesion. The lesions blanch, fade, when pressure is applied to the central arteriole and refill from the center outward when pressure is released, a feature helpful in diagnosis. Review your medication history, particularly the use of hormonal therapies, like oral contraceptives or hormone replacement therapy. Assess alcohol use, as chronic alcohol consumption is a major risk factor for liver disease. Conduct a physical examination to look for other signs of liver dysfunction such as jaundice or ascites. Order blood tests, particularly a liver function panel to assess for markers of liver injury or insufficiency. A liver function test evaluates the levels of key enzymes and proteins produced by the liver. Abnormal levels may indicate liver inflammation, scarring, or cirrhosis, all of which can be associated with spider nevi. Treatment options for spider nevus. In many cases, treatment is not necessary, especially if the lesions are asymptomatic and not linked to an underlying condition. However, treatment may be considered in the following situations: cosmetic concerns, discomfort such as itching or burning, or association with liver disease that warrants broader medical management. The most common and effective treatment for spider nevi is laser therapy, particularly with vascular-specific lasers, such as the pulsed dye laser, or PDL. This procedure involves targeting the lesion with focused light energy that destroys the abnormal blood vessels. You might feel some mild discomfort during the procedure, often described as a stinging or burning sensation. Typically, it requires about 2 to 5 sessions for optimal clearance. Laser therapy is safe and minimally invasive, though temporary redness or bruising may occur following treatment. Can spider nevus be prevented? While complete prevention is not always possible, especially in individuals with a genetic predisposition, certain measures may help reduce the risk of developing new lesions. Avoid unnecessary hormonal therapies, particularly if there is a personal or family history of spider nevi. Limit sun exposure by using broad-spectrum sunscreen, especially on frequently exposed areas such as the face, neck, chest, and arms. Reduce alcohol consumption to minimize the risk of liver disease. Seek timely treatment for liver conditions including viral hepatitis or cirrhosis. For individuals with multiple or recurrent spider nevi, regular follow-up with a healthcare provider is advisable to monitor for signs of systemic disease. And that's the lowdown on spider nevus. Remember, while most are harmless, sudden clusters could signal underlying conditions like liver changes or hormonal shifts, so always consult a dermatologist or doctor first. If this video helped you understand those mysterious red marks, smash the button, subscribe for more health mysteries solved, and ring the bell so you never miss our tips. Have a spider angioma story or question? Let's chat in the comments. Thanks for watching, and keep prioritizing your health. See you next time.